I want to do a demonstration of what I had mentioned earlier in the video where I talked about AED and CPR. Now, I gave a detail about what CPR is and AED. Now, this is practically going to be the demonstration of it. While somebody is down, the first thing, like I mentioned earlier, is to be able to look around to find out whether there are objects that have caused the person to collapse or to fall. Now, it could be pole, it could be snake, it could be anything that's harmful for you and or the victim on the ground. When you've looked around and you have satisfied yourself there is no problem, then you can call out. If you know the person's name, call the name. If you don't, just simply say, hello, how are you? Are you all right? You don't need to put in the how are you. Okay? And then if the person doesn't respond to you, you can approach. Now, the first thing that you do before you even touch the victim is, if there's somebody around, you quickly ask the person to call the emergency number in your area, 911, 999, 112, so that help can arrive. And at the same time, you ask the person to get an AED machine. Remember, I talked about AED, defibrillator. Now, as you have given that instruction, the next thing you do is to check the airway, whether the tongue had fallen back to block the airway. Once you are satisfied that is not a problem, the next thing that you do is you start CPR immediately. We want to keep this person alive. So what do? How do we go about CPR? I did that in my earlier video. So one hand on the lower part of the chest, the other hand on top, then lock. Then you compress down. Now, in compressing, remember I also mentioned 30. After 30, then you give 2 sharp breaths. Now, remember also, when you give that sharp breath, it's going to be about 5 to 6 minutes between breath. And when you do the breath, you check whether the chest rose. If the chest did not, you tilt the head or adjust the head properly. So I'm going to just demonstrate that, and I will do exactly what I just talked about now. My hand is placed. Now go to the top, interlock, and then I will start my count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then go straight to the mouth. While I do that, I'll go back straight on. Remember, I said 30 each. I can do 100. Now, while I am doing that, I am still on with the compression. Supposing AED has come. So, for instance, in this case now, I have the AED. Now, it's been brought to me. This is the AED. This is what it looks like. Now, I'll simply pull this front to get to the pad. When my earlier videos talked about the green button, which is this, and then we talked about the orange button, which is this. This starts the defibrillator. This administers the shock. Now, I have scissors here to cut out the shirt or whatever it is that may be covering the chest area and all. So this is the complete AED machine. But then I'm not going to use this for the demonstration. I would rather use mine, the one I use for training, which is the same thing. It also has the orange button, and then of course this one is indicative of the green button. Okay, so this is where I'm going to use. This is what I'm going to use. Now remember what it said, AED, how it's applied. First of all, it says peel out this. Okay, and apply one on one side of the chest and the other one on the other side of the chest, a bit lower. Okay? Once it's been done, applied, and I'm going to use that. Remember also, I mentioned earlier that you don't really have to do anything. Once it's been placed, the machine will do the analysis. So all you need to do is to put it on. But remember also, stay clear. Okay? So I'm putting it on now. I'm pressing the green button. Analyzing it. It's analyzing. Do not touch the patient. Now it's a realize that shock should be applied. It's charging. Stay clear of the patient. I'm being advised to deliver shock. So I'm pressing the yellow button. Shock has been delivered. It's now telling me to go on with CPR even after the shock. So you just simply follow the instruction. You follow the instruction while it is going on. Where I'm going to do the CPR, I'll continue with the CPR. Remember, it's still going on, showing indication, being prepared for another analysis, analyzing and all. So I will go on with the same process I've been going through until help arrive, or if there's a change. If there's any change in this in the state of the person, I can just simply put the person in a comfortable position until the help arrives. That is CPR and the use of AED. Thank you very much.